here, and I would like to introduce Ashley Quan, and it sounds like she is the perfect person to talk to us today, as she's the Senior Manager of Research and Government Relations at Feed Ontario, a charity that supports a network of food banks across the province. Her work focuses on creating tools and opportunities for food banks to engage in community organization and advocacy, producing research on how food bank use intersects with social welfare, labor, and housing policy, and also working with government partners and like-minded coalitions to advance evidence-based solutions to food insecurity and poverty. Now, as if that's not enough, outside of her workday, Ashley is also a passionate advocate for active transportation and city building, currently serving as the president of the board of directors at Cycle Toronto. Now, for those of you who know me, I'm a very keen cyclist, so you're really in my good books, Ashley. She's also worked on several municipal and provincial electoral campaigns. Recently, she set a goal for herself of visiting all of Canada's national parks. Yay, Canada. So, welcome, Ashley, and over to you.
Thank you. I'll just get my screen sharing set up. Everyone can see that. I have all the things in front of me. Slideshow. Great. Perfect. So yeah, thank you so much for the introduction. I am with Feed Ontario, and it's so nice to be speaking with you guys today. I will have to hop off after I do my presentation and some questions because I'm also at a course today, so I'm just stepping away to do this. But I'm happy to take some questions, and then if you have further questions that you thought of later, I think the ladies are going to pass it on to me so I can answer by email. So Feed Ontario, we are a charity that supports food banks all across the province. So this is a bit of a map of what our network looks like. So these blue dots are our direct members, and the green dots are our affiliate members. So we have about one member per municipal boundary. We have 140 of them, and then they serve about 1,100 affiliate members all across the province. So that includes, breakfast clubs, food pantries, meal programs, all those sorts of things. So we have a pretty extensive network. So we kind of sit at the center of all that. We're a grassroots organization that was founded in the 90s by our food banks to support their work so that they could be better connected to each other and have a provincial body to advocate on their behalf. So our vision is an Ontario where everyone is food secure. Our mission is to champion an impactful network of hunger relief organizations and advocate for solutions to end food security and poverty in Ontario. So how do we do that? We sort of describe our work with three pillars. So feed on, feed possibility, and feed change. Feed on is really like a lot of where our money goes, which is that food piece. So we have a bunch of partnerships with organizations like Chicken Farmers of Ontario, egg farmers, dairy, beef, that kind of thing, and we do a lot of fresh and frozen food that we provide to our food banks, as well as large scale food donations and food purchasing to really sort of spread the wealth out over to food banks, all of our member food banks, because we know that some communities are better supported than others, but there is need everywhere, and so we want to sort of even that out and provide support to everyone, as well as facilitate food sharing because some places also have a lot of food manufacturing in their area, but they can't actually absorb all that food, so they come to us and we help spread it around. Feed Possibility is sort of our knowledge sharing and capacity building for our network. So we do conferences, webinars, skill building, all that sort of thing, to share best practices, share knowledge. There's lots of our food banks are so innovative, and they're coming up with new things all the time. But on their own, they can't tell everyone about it. So we play that sort of hub and they're the spokes, and that's how we share a lot of information and make sure that everyone has a high standard of practice. And then feed change is really our department or my department. So we're a small portion but mighty, I think, of our organization, and that's where that sort of research advocacy piece comes through. So we approach it in like four different ways. So that includes research. So we have a cloud-based client intake system called Link to Feed that all of our food banks are on. So every time someone comes to a food bank, first time they visit, a profile is created with some basic demographic information about them. And then every time they come to visit after that, another visit is logged. So we can track in real time who is coming to use food banks, and where and how fast that growth is happening, and get a lot of insights, and that helps inform our recommendations. So we produce something every year that I write called Hunger Report. So it comes out at the end of November, beginning of December, and it is just a look back on what the trends have looked like over the past fiscal year, in terms of food bank use, what's driving those trends, that sort of thing. And then we also produce, recommendations and that piece. We've also produced a report that's super popular in our circles, I guess. It's called the cost of poverty. And so that report, we looked at, what does poverty cost, like our justice system, healthcare, and then, opportunity costs. And, if we reduce poverty, how might Ontario save money? So we, use that as kind of like a business case when we're advocating for our goals. Advocacy. So we work with government. So we advocate for policy change around social assistance, affordable housing, and labor. So those are our three main pillars in terms of advocacy, as well as other sort of little things, like student nutrition programs, that's kind of thing. Um, and so we just fundamentally feel that uh, food banks are really almost like an emergency service, right? And so ultimately, poverty and is the root cause of food insecurity. That's why people are turning to us. And as I'll explain coming up in talking about what food bank use looks like, the food bank use has become so unsustainable that really what we need is, more than ever, is to look at those root causes of what's driving people to come to food banks. Because most food banks can really only afford to hand out like a few days to a week's worth of food every month to someone who comes to visit them. But people's needs are much greater than that, and it doesn't really solve the reason why they're coming in the first place. So that's why we do advocacy. We work with government. We put in submissions. We do days of action. So we bring our food banks to Queens Park. We meet with people in government, and empower our food banks to do the same. And then public education. So we're trying to, move into that thought leadership piece, producing, op-eds, blog posts, that sort of thing. We did a really great panel in December in conjunction with Hunger Report, where we talked about myths and misconceptions around who's using food banks, that sort of thing, to really dispel some of the harmful myths that people have about why people are visiting, just to change the conversation. And then finally, we provide a lot of tools to our food banks, so that they can do that sort of advocacy and public education themselves. So we do a lot of that development. So because a lot of food banks, they are volunteer run. They have maybe a few people working and don't really have the capacity a lot of times to really engage in a lot of that advocacy piece directly themselves. They can barely meet the need that is of people coming through their doors asking for food, much less focus on developing their own campaigns and stuff. And so that's the kind of support that we're trying to provide them. So what does food bank use look like? What has it looked like over the last couple of years? So this is from our 2017 hunger report. So it was one of the first ones that, the third one, I guess, that I designed and helped to write. And so you can see there, 2017, we had 499,000 people visiting a food bank. Um, this one is our 2024 hunger report that just came out, and we unfortunately passed this milestone of over 1 million people. So that's doubling in what's like 7 years. And unfortunately, the capacity of food banks there really hasn't kept up. As the situation has gotten worse, people are less able to donate. A lot of donors are becoming food bank visitors. So the resources really haven't kept up with the demand, which is very unfortunate. Um, and if you look at it, we have had population growth in Ontario, but we've seen, even if you look at it as unique individuals as a percentage of the population, that has increased from around, I guess that's like 3.5% to more than 6%. So again, it's growing pretty rapidly. A lot of the increase has come in the last few years. And then visits have done much the same sort of thing, just really rapidly increased. Um, and then it's also, sometimes the perception is oh, it's only a problem in the big city. But, we have heard from food banks all across the province that this is a problem. That, you can see in every region that we have in Ontario, north, central, east, south, west. We've seen double-digit increases over the last year in terms of both unique individuals and visits. Um, and then, in terms of what this has looked like in a historical context, there is, when you look at the increase relative to the year before, we saw in, after the recession, like a pretty significant jump in 2009 compared to 2008, and then a jump again, slightly less large. And then it started to, sort of settle out. In a couple of years it decreased, but then again and started to pick back up in 2018, started to increase again. That's these, oh sorry, teal bars, until it really started increasing over the last 2 years in a very unsustainable fashion. You know that sort of overall increase between over the last 2 years is triple what we saw after the 2008 recession. And so obviously also we're a bit worried about what tariffs might do to people if we're already at a million people visiting food banks. We can't predict the future, we can't control it, but that is definitely a pressing concern as to the impacts on unemployment and that sort of thing. And then in terms of looking at province by province, like we have seen food bank increase everywhere across the country, but Ontario, compared to the other provinces, when looking at 2019 numbers, has experienced the highest increase. And then, of course, Quebec's pretty high as well, BC, Alberta, PEI, and then the others were a bit more moderate increases. And then, like I mentioned, there's a lot of resource constraints in terms of, food's getting more expensive for food banks, just like everybody else. The amount of donations is not keeping up with the demand. There was a surge in generosity that we really appreciated during the pandemic, but a lot of that has since run out or dwindling down. So when we asked food banks, how many of you had to cope with the increased demand, and around a third said that they had to reduce the amount of food they could give during a visit. And you can see in the news, food banks like in Ottawa have had to reduce their food. Our food bank in Mississauga has had to unfortunately cut some staff because they just weren't financially sustainable otherwise due to the high demand. And then if you're looking at, this is kind of like a niche thing, but this is something I covered in Hunger Report this year. So when the government's talking about, oh, poverty is not that bad, there is, I think, a disconnect between how the government measures poverty, which is the federal government measures it with something called the market basket measure. And so you can see, it dipped in 2020, probably in large part due to supports like CERB and enhanced EI and that sort of thing. It has started to go up. But if you look at severe and moderate food insecurity, which is kind of measured separately, you ask, it's a survey, you ask households, have you had difficulty accessing food? There's a whole sort of questions that they ask. And so that's more of a material kind of question as opposed to the market basket measure just measures, your income compared to what they think like a basket of goods should cost. That there is a real disconnect. And so I think that, asks a lot of questions about both how we're measuring poverty and people's perceptions of, how well our country is and our province is doing. In terms of drivers. So we're actually seeing, if you look at the sort of long-term trends, this is as like a percentage of the whole of who's using food banks. We saw that seniors, they really were growing as a percentage of all food bank visitors up until 2021, 2022. And then it actually started to go down. And so my theory for that is that there was a increase that the federal government made to old age security at that time, which sort of coincided with that decrease. Like, all the age groups are increasing as an absolute number, but the seniors are not increasing as quickly, I guess, as other groups. And so it kind of, I think, is a bit of a testament to those sort of income security programs and how those interventions can really help. We've also seen sort of a similar trend with children. Children used to be, if you look at our like 2008 numbers, our very early numbers, it was almost 40% of people visiting food banks. And so we've since seen that trend really decline. And our theory again with that is that there have been a significant amount of child supports that have been introduced over the last, how long has it been since 20 years, I guess. So that's we've been tracking it. And that includes like the Canada Child Benefit, the Ontario Child Benefit. You have full day kindergarten, some increase in funding to student nutrition, all those sorts of things we think probably contribute to children decreasing as a percentage of the whole. Um, and then adults, we're seeing that young people in particular, the sort of 18 to 30, if you decompose that even further, is really driving a lot of people accessing food banks, really that working age population. And so you're seeing historically the sort of majority of people visiting food banks, if you look at their primary source of income, it has been provincial social assistance programs. So that we have two. That's Ontario Works, which people often nickname as welfare. It's meant for people who are considered, working age and able to work, but just are low income. And then the Ontario Disability Support Program. But we're actually seeing an increasing number of people who are employed, which I think speaks to the precarious nature of employment, how gig work and that sort of thing is really not keeping up with the cost of living. In terms of housing, so rentals are the by far the biggest group of people who access food banks. So this is in absolute numbers. So because if you look at relative change, nothing looks that different, but you can see that a lot of the growth really has been in people, taking that market rental versus, subsidized housing hasn't grown that much. Homeowners haven't really grown that much, despite increases to like mortgage rates and that sort of thing. But we have seen it's homelessness has always been a relatively small proportion of people that we serve, just because a lot of times food banks, when we measure this, it's of that sort of traditional food pantry where you get ingredients. So our network does, help with homelessness, but it's not directly measured in this sort of data collection that we do. But we still are seeing a significant growth in all types of homelessness. So that's on the street, couch surfing, with friends and family, in a shelter, that sort of thing. So, um, what else? So we find that these I said we had a panel recently about myths and misconceptions about people using food bank. There's a lot of them, and that's something that we try to combat as well. About who deserves help. Are people scamming the food bank? Are people using the food bank when they're actually rich and drive a Range Rover? Is it just because they're like immigrants who are trying to scam the system? All that sort of thing. So that's something that we actively try to combat. We do know that, about, I guess, like the two-thirds of people who are accessing a food bank identify as having some sort of disability. The most common being some sort of like mental health issue, but also, you have like a lot of physical illnesses, pain, diabetes, that sort of thing. You can see the graph. So it the people who are accessing it largely have some sort of barrier, whether they might be able to work a bit, but they can't work as much as they would like because of various reasons, disability, caretaking, that sort of thing. And so it's fortunate. This is a great quote from one of our members in Beamsville that was featured in Hunger Report that basically talks about that sort of perception of scammers. Um, and they admit that sometimes there are some, but it's a very, very small percentage, maybe 2% of people, whereas 98% of people who are coming really have good intentions, genuinely need the help. And so the question is when we're looking at, our own policies about are we making it harder for people to access through more means testing, screening, that sort of thing, it can be a very difficult experience to ask for help in this way and say that you can't do it on your own. And so we are committed to, reducing those kinds of barriers for people because we know from talking to all our food banks that the vast majority of people genuinely need it, and we're just trying to not make things harder for them, just to, catch the few bad actors who are out there. Um, I know immigration has been, and international students have been a big thing in the news. So we had one of our members in Sarnia speak to this. He spoke so beautifully of how they did have a fair amount of international students coming to their food bank because they have a college nearby. And they actually, engaged proactively in conversations with them to, talk about what a food bank is for. And so many of them didn't actually need the food bank and they were embarrassed. They didn't know because food banks didn't exist in their home country. And so they realized, like, oh, we're not going to come anymore. We're actually going to be giving back. So they came and volunteered and donated and that sort of thing. And there were some who needed help, but it much less. So that was a nice, good news story. And then in terms of how we approach our policy, so like I said, we have social assistance, housing, jobs. Those are our sort of main pillars. So we really, because around half or so of people visiting a food bank are reliant on ODSP and Ontario Works, a lot of our recommendations focus around that because that is, I think, what's controllable the most strongly within the provincial government. So that includes things like increasing the rates. A single person on Ontario Works only gets $733 a month, which is really, that's for your housing, for your food, for your transportation, for all these things. So it really doesn't, it's hard to get a job when you can't, focus on the interview or you can't afford a phone. You can't, you're all you're doing all day is trying to scrounge up enough resources to survive. There's a single flat rate. So one of the things that we find is that if you become homeless while you are on one of these programs, they actually give you about half the amount that you got before because you don't qualify for the shelter portion of the benefits anymore. So that really fuels our homelessness crisis. There's a lot of clawback, so there's just especially on earned income that make it very difficult for someone to get ahead. So if you're trying to combine your Ontario Works with a minimum wage job, that sort of thing, you get a lot clawed back. There's a bunch of other things I won't necessarily get into, but building more affordable housing is a huge thing. Rent control, Wage theft is a problem. It's the reason why a lot of people visit because they have been working, but their employer isn't giving them all the money that they're owed, and they're already paycheck to paycheck. Gig workers is a problem, that sort of thing. And then overall, we're also looking at the provincial poverty reduction strategy, which is going to be the next 5-year one is coming up soon. So providing recommendations because that is really not actually focused that much on reducing poverty and more about getting people on social assistance into jobs. But as we know, lots of people who are working are still visiting a food bank. So and then I know you guys wanted to talk a bit about tools and action that you can take. So we do have an election campaign going on right now. It's just on our website. So you can speedontario.ca/election25, I think. And I gave the link to Pat and Silla, but on there we have a platform monitor. So we are tracking what all of the parties are saying about what they're going to be doing about social assistance, housing, jobs, and like an other section. So you can it really, so you don't have to do your own research. You can just look at this and we tell you what they promised, especially because a lot of them are not actually reduce, producing platforms in the same way as they do during a normal election cycle. And we also have a petition to let our parties know that we need bold action on poverty. So you can sign that. We have a tool called Hunger in My Riding, so you can generate reports on what hunger looks like, food bank use, food insecurity rates, that sort of thing in your community. And save the report as a PDF, send it to your MPP. And then finally, Fork in the Road. So this is an interactive experience. So it's kind of like a choose your own adventure sort of thing. So you go through it, you pick one of 4 profiles that represents, someone who might need to use a food bank. And then you go through and you say, this is the amount of income they have at the beginning. Can you make it to the end of the month, in the black without needing to use a food bank? And so just trying to get people to understand some of the forces that drive people to needing. And I think that's it for me. Does anyone have questions?
Hi, Ashley. This is Linda. I've actually been monitoring the chat, and so do have two quick questions for you. One is related to the election, and little did we know when we started talking a month or two ago that we'd be right in the midst of an election here in Ontario. Um, but could you? I think in your one slide you have a message. We need to build a stronger strategy on poverty. What would a key message be? Can you recommend something that we could say at the door when, a candidate comes knocking? Um,
Yeah. So how we've been sort of framing the messaging is, yeah, we need bold action on poverty. But what I think is kind of the hook is, everyone's real concerned about tariffs, very understandably. And there's a lot of focus on, how we're going to fight Trump and that sort of thing and prevent them. But, tariffs might happen regardless of who is the premier. So I think one of the things we can control is the social safety net that's in place for people. So, how are you going to protect people who might need to access it? And one of the other things that we talk about often is that part of the reason we're so vulnerable, I think, to things like tariffs, pandemics, AI, whatever the latest emergency is because our foundation of our social security net is not strong. And so many people fall through the cracks. I don't know, like housing is so unaffordable, and because we haven't been building, enough affordable housing to really, keep up with the demand. Our so many people have to go on Ontario Works because EI has become much worse than it was, 30 years ago. We have a good report on it that I wrote a couple of years ago that looks at, if someone who was sort of goes through similar life experiences, but was born in maybe the 60s versus someone who was born in like the late 80s, and what their different interactions with our social safety nets and the job conditions and that sort of thing. And it's so different. I know I'm like younger on the younger side, but I talk to my parents, and it's difficult to make them understand how challenging it is. But I know, my mom had to recently use EI because she's going on a caregiver leave for my grandma. And she was so surprised as to how difficult it is to navigate that system, how challenging it is to just get that money. And, she wouldn't be, in the poorhouse if she wasn't able to access it. But a lot of people are, right? And a lot of people face those difficulties in getting access to those systems. And then they end up on Ontario Works instead. And um, uh, that provides so little support, and it makes it even more difficult once you fall into that level to dig yourself out of poverty, because at every turn there's something, clawbacks, there's all these rules that really make it difficult to achieve that kind of like independence and escape poverty.
Okay, thanks for that. I just have one more quick one. And the questions starting to roll in, and I know that you've
Yeah, we
said,
have had them for quite a while, Linda. So, and
yeah, you would
we need
respond.
to be mindful of the time. So maybe we should go to our other questions first, if you don't mind, Linda.
Uh, I'm sorry I missed that.
Oh,
I
we have a
was,
few questions in the chat, and I'm just being mindful of the time. I wonder if we should go to those ones first.
I'm, yeah, I'm thinking
You're not
I know
hearing me?
Tina will have to leave. My suggestion would be that we send the rest of the questions to Ashley so that we can welcome Loubna to the webinar and let her do her presentation. And does that work for you, Ashley, if we
Yeah,
record those
absolutely.
questions? Okay.
perhaps
And if
then before you leave, Ashley, I can just say a big thanks. Thank you so much for stepping aside from your course today. Your presentation was just rich with information, just exactly what we needed, and it's information that's being replicated across Canada. I mean, food banking
Mm-hmm.
is the same in every province.
True, yeah.
I think some provinces have done a bit of a better job in terms of social assistance. Ontario's really, pretty bad in that regard. But I just want to say, big thanks, and I want to thank you very much for your hunger report, 2024 hunger report. Great report. I just got so motivated
Oh,
reading that
good.
report in terms of
That's the goal.
advocacy. So we'll make sure that we get that report out to our members, because I think it's just provides so much good information in this current situation.
Okay, awesome. Yeah, and I'll let you guys go and let Loubna do hers. But it was so great to see all of you, and I'm excited to answer your questions.
And hopefully we can stay in touch.
Absolutely,
Yeah,
yeah.
we
Okay.
will, and I'll be sending you some questions. And from me, thank you so much.
Okay, sounds good.
Okay. Okay, you
Bye.
take care.
and if
So,
anyone else has a question that you think of in the meantime, just add it to the chat because I'm going to be saving that.
right. Okay, so now it's my privilege and pleasure to introduce Loubna Batlouni, who is a public health professional with a master's degree in public health, specializing in health promotion and community health. That's a lot of health. With over 12 years of experience in the health sector across development and humanitarian settings, her expertise in maternal and child health has been honed through her work with international organizations in the Middle East, including the World Health Organization. She's currently serving as senior technical advisor with Save the Children Canada, supporting initiatives aimed at enhancing health outcomes for vulnerable populations. So welcome, Loubna. It's really nice to see you, and we're looking forward to your presentation.
Thank you, Stella. Thank you so much. I'm going to just share my screen. I'm going to take just 1 second to do this and make sure that it works. Thank you.
We're seeing your full page now, Loubna.
The full page, great. So the slide without the next slide, right?
Yes, but we're seeing the sidebar as well. Now it's just the slide.
That's perfect.
Yeah.
This is good? Okay.
Yes.
Great, great, great. And I think I can control I think I can control the slides from here. Okay. Great. So thanks again. Thank you to the GRANs team for inviting me to participate in this webinar and for giving Save the Children Canada the opportunity to present about our work on the issue of child hunger. Today, my presentation is titled Looking Beyond Food, How Do We Address the Hunger Crisis? And the presentation is based on a report that was recently published by Save the Children, and the report is called Looking Beyond Food. I will be sharing the link to that report if someone is interested in reading more about the topic and seeing that content in details. So first of all, I just want to say that in the initial meeting I've had with the team, we discussed like what kind of information GRAN members already have about the topic, because I didn't want to present any information that people already know, anything that is redundant. So I saw the website, I saw the resources there, I saw some presentations from previous events about the topic. So you already know a lot about it, and you already know like the definitions and the basics about this topic. So I'm not going to be repeating that. I'm just going to start right off from our work and what we do. How do we intervene to tackle this issue? And then we're going to talk a bit about what else can be done to support this cause. So just a bit about Save the Children. So Save the Children is an international non-governmental organization. Our mission is to help the most marginalized and hard-to-reach children around the world. We've been around for more than 100 years. We were established in 1919, and we are working on child health, education, and protection. We have offices in more than 100 countries, and we reach over 100 million children every year. We target children needs and their unique needs through to contextualized interventions to give them a healthy start in life and to create lasting change, not only for them, but for their parents, their families, their communities. Ultimately, the goal is to transform the future we all share. So just a bit of background around the topic and what we know so far. So we know that the world is facing a hunger crisis, the likes of which have no place in the 21st century. So there are growing inequities, conflict and climate crises, all of these crises combined with rising food prices, the overabundance of unhealthy foods, harmful food marketing strategies, poor child feeding practices. All of these condemn millions of children to child food poverty, to child hunger, to malnutrition. So today there's an all-time high of 45 million people who are facing emergency levels of hunger and are at risk of falling into famine. Actually, we have around 1 million people who are already experiencing famine-like conditions. The crisis is hitting children hardest. So they're a vulnerable group of the population and they are being hit hardest. And this is basically pushing one child into severe acute malnutrition every minute. It's a life-threatening condition, especially for children. It leads to muscle wasting, reduced organ function, and severely weakened immune system, turning some common childhood illnesses into killer diseases. There's at least 13.6 million children who are currently severely acutely malnourished, while up to 60 million could be acutely malnourished. 149 million children are also stunted due to sustained undernutrition, which irreversibly affects their long-term health. So these are some of the shocking numbers that we see when we talk about this crisis. Another thing I'd like to talk about before I start talking about the interventions that we do, because this is going to set the stage really, is to understand how we do these interventions and what's the evidence that we used. How are these interventions basically based on evidence that we know about child health? So For this crisis, we need to do more and better. So while we want to scale up funding for emergency response, we also want to save lives and protect children's futures through important health and nutrition interventions. And these are low-cost, high-impact interventions. So just some information around the evidence that we know about child health, but specifically about the first 1,000 days of a child's life. As you know, these first 1,000 days are crucial and critical for a child's development. So getting the right nutrients, particularly in the first 1,000 days of life, is critical to a child's survival and healthy development. We're talking here physical and cognitive development, of course. If they don't eat sufficient nutritious food, so it's not just sufficient food, it's sufficient nutritious food, children would be at high risk of becoming malnourished. And undernutrition is linked to 45% of all deaths of children under 5 globally. This is because, as you might already know, malnutrition weakens the immune system, and a severely, acutely malnourished child is much more prone to common diseases. They are 11 times more likely to die from a common disease than a well-nourished child. We also know that there's a link between diseases and malnutrition. So diseases and infections are a significant cause of malnutrition, especially when we're talking about context where there's a humanitarian context or an emergency context. Well, the health system is already overstretched. There is lack of access to safe water and poor hygiene and sanitation. All of these are sources for infections and diseases. And this is going to result in diarrhea, parasitic infections, all of which prevents the absorption of nutrients. So we can see the correlation already and the links there. So without treatment, this can quickly lead to a child becoming acutely malnourished. So treating malnutrition requires a different approach than just responding to food insecurity. So of course, it's important to provide basic food staple, and they do provide the calorie needs and they relieve hunger, but there's much more that a malnourished person needs. We need more nutritious food. A person who's malnourished needs micronutrient supplements, special therapeutic foods, and sometimes they even need medical treatment. So I'm talking about all of this because you're going to see how this builds into our interventions. So simply relying on basic food staples is not going to solve the crisis. Without the types of interventions that I mentioned, it could lead to just more cases of malnutrition, and just relying on basic food staples would change the nature of that crisis, but would not solve it. So this diagram, just quickly, also this is related to how we design our interventions. So I just wanted to quickly walk you through this diagram because it helps us understand really what are the risk factors and what are the treatment options. So as you see, the more severe the malnutrition is, the more complex the treatment that's required to treat a child. So if a healthy child is lacking nutritious foods or is not being breastfed and there are infections, he or she is suffering from infections or diseases, they could become acutely malnourished. And if that child that is acutely malnourished is undetected, we don't know that they're suffering from this, we don't offer treatment, this could be the situation would be exacerbated and we would have a severely acutely malnourished child. A continued lack of treatment or other infections would lead to a severely acutely malnourished child with health complications. And this could lead to child death, preventable child death. So this is the importance of how we intervene. One, when a person is severely acutely malnourished and has a child, when they're severely acutely malnourished and have health complications, they usually require inpatient hospitalization and they require therapeutic milks and medical care. And then if we detect someone that a child that is severely acutely malnourished, but doesn't have health complications, we would need some medical treatment, maybe some outpatient treatment, and we need to provide some ready-to-use therapeutic food, and we can talk a bit about RUTFs later. They might need antibiotics and deworming also. As we said, like parasitic infection basically decrease the ability of the body to absorb nutrients. So that's why we would also go towards deworming. And if we detect that a child is acutely malnourished, they might need just some outpatient treatment with some special foods and deworming. And these are some simple, low-cost interventions that can be done to tackle this issue. So just very quickly, when I say RUTF, I'm talking about, you probably maybe already know this type of food, but it's what we call ready-to-use therapeutic food, and it's an energy-dense micronutrient paste that is made using peanuts, sugar, milk powder, oil, vitamins, and minerals that are essential for children that are threatened by malnutrition or that have severe wasting. You might have heard of Plum Peanut. Plum Peanut is the first type of, or the first brand of ready-to-use therapeutic food that was designed to treat severe acute malnutrition. We're going to talk about other concepts later, but now I would like to go into the interventions that Save the Children implements once we want to intervene in a country or in a community that is facing a hunger crisis, that is where there are children that are malnourished. So first of all, and most importantly, we work in a comprehensive approach. So we don't just want to treat the cases, but we also want to prevent certain cases. And we also want to build a health system that is strong enough and resilient enough to be able to receive cases and treat them properly. So we are working with early detection on the child themselves when they're malnourished. We're also working with the community. We're raising awareness. We're promoting certain techniques that would help families detect malnutrition in the household. And we're also investing in primary health care to basically strengthen the health system so that the healthcare providers can cater to the needs of malnourished children. So the first one and the first recommendation or the first interventions that we adopt is scaling up early detection and treatment of acute malnutrition to reach at least the 80% of children who are not currently getting the treatment they need. They are undetected sometimes in the community, and they're left undetected for a very long while. If they don't receive the treatment that is needed, it would just lead to an exacerbation of the cause, and as we saw, to a preventable child death. So how do we do this? First of all, we would want to provide life-saving treatment for children that are acutely malnourished. This includes the RUTF we talked about, and this is a life-saving interventions. We want to also enable community health workers to treat children with acute malnutrition. So this makes it more accessible for families than traveling to the health facility. They would get a visit from community health workers who would check if the child has malnutrition and would advise the family around this. So as you see, we are here training community health workers. There's no need. So this is why it's low cost and high impact. We don't need someone who is a specialized doctor, for example, to do this. These are some simple recommendations, simple guidelines that we train these community health workers on, and they would go go for outreach activities in the community to go to the households and check if a family member is suffering from malnutrition. We can also train families and caregivers and mothers to identify if their child is malnourished by scaling up what we call the family MUAC approach. So what is the family MUAC approach? You probably saw in the first picture, in the second picture, and we're going to see a few more pictures where the child has like a band around their hand. And the MUAC approach is an approach where we train the mother or the caregiver to identify early signs of children using a simple tape that is called the mid-upper arm circumference tape. So that's where the MUAC name comes from. It's this color-coded paper or this plastic band that is put around the upper arm of the child to determine if he's well-nourished, at risk, or malnourished. And then based on that, the community health worker or the mother would have a series of guidelines to follow to offer the right treatment for the child. So what is the opportunity here? It's that we have rapidly expanding treatment coverage for acute malnutrition through innovative and cost-effective adaptations for treatment methods, which will save lives and give better value for money when we invest and when we fund these interventions. If we don't do this, the majority of children with acute malnutrition will continue to go undetected and untreated, resulting in serious long-term health impact on children's lives. The second recommendation As we said, we want to work on, the first recommendation was about detecting, treating, but also the second recommendation is we want to prevent even getting there. So recommendation number 2 is to protect, promote, and support infant and young child feeding, particularly breastfeeding, which is one of the most effective ways of preventing deaths in children under 5. So IYCF, which stand for infant and young child feeding practices, IYCF practices are very important practices that should be adopted and are basically set by the World Health Organization, and they entail early initiation of breastfeeding, exclusive breastfeeding under 6 months, continued breastfeeding for 1 year, and then introduction of solid or semi-solid foods, nutritious foods, also a minimum dietary diversity to make sure that the child gets all the vitamins and minerals that are needed. The IYCF also includes minimum meal frequency. So it's about the frequency of the meals, but also the nutrients in the meals, so that they have an acceptable diet. Also, the food needs to be iron rich and iron fortified. So that's what we mean when we say IYCF. And in this intervention, we invest in nutrition counseling. We talk to mothers, to families, to communities about the importance of breastfeeding and young child feeding, especially during emergencies in humanitarian settings. It is also important here to talk about the code of marketing for breast milk substitutes. So we know there are a lot of aggressive marketing techniques from the commercial milk formula industry that push milk formula. So that is also something we work on with advocacy with these corporates to make sure that these code of marketings are respected. The international code of marketing is respected in marketing campaigns. The opportunity here is to ensure infants and children get the best possible nutrition in their early years, especially in the first 1,000 days, because that would dramatically improve child survival. The risk if we don't do this is that more children will become malnourished and at greater risk of disease, nutritional imbalances, infections, and death. So we talked about the two recommendations. Now the third recommendation, and I'm going to go back to what we said at the beginning about the correlation between illness and disease and malnutrition. Hence the importance of strengthening the primary healthcare services in these communities. So we invest in community and primary healthcare to prevent and treat childhood illnesses, which can both cause malnutrition and pose significant risk to already malnourished children. So what we do here under this recommendation is we want to invest in improving access to safe water, sanitation, and hygiene. So WASH, what we call WASH. This is very important as an intervention or as a way to prevent the spread of diseases. So we also want to increase vaccination coverage because that will also help in decreasing the rate of communicable diseases in the community, especially among children. And we would want to also strengthen systems for rapid disease detection and response. So when we talk about early warning, which are these systems that are set in communities or in through the health system to detect the cases, to intervene quickly before the virus, for example, spreads or before the infections rates get quite high. So the opportunity here is that we would be able to prevent infections and disease, and we would protect children's health with especially children who have critically compromised immune systems. The risk if we don't do this is that we're going to have high rates of malnutrition, which when combined with disease outbreaks, we would have a very high rate of child deaths in a community. So in summary, there are a few messages I'd like to just mention before I get to the conclusion of this presentation. First of all, the present hunger crisis is a great threat to children, and we can only protect them by taking a comprehensive approach. Hence the importance of these interventions and the holistic approach that we adopt when intervening in a community. We cannot tackle one issue and forget the other. So we must go beyond addressing food security alone to include a stronger focus on nutrition, health, water, sanitation, and hygiene. And then failure to do this will result in preventable child deaths in the immediate future, as well as health impacts for lasting, like health impacts that would last generations. So it's important to have a comprehensive approach. The second point we want to highlight is that these three key low-cost, high-impact interventions have great promise. So community-based treatment of acute malnutrition, supporting breastfeeding and IYCF, and investing in community and primary level healthcare are three very critical, important interventions. And together, these can dramatically improve child's access to life-saving treatment and significantly reduce the number of children who become malnourished. The third point we would like to highlight in this presentation is that this crisis must be the last child malnutrition crisis. This means being more prepared for future shocks and embedding early warning, early action approach. Governments and donors must invest in disaster preparedness and climate change resilience to prevent food shortages in the future, to prevent these crises in the future. They must also scale up anticipatory action and social protection systems so that this help so that help could reach families sooner. And in these situations where help can reach families sooner, we would have a greater impact before the situation exacerbates and becomes even more complicated. Another point that is very important is the investment in building longer-term resilience, whether by strengthening health systems, having early warning systems, tackling malnutrition in all its form. It's quite important also that governments and donors commit immediate and long-term flexible funding to health and nutrition, water and sanitation and hygiene. And it's very important that these governments and these donors honor these existing commitments. A lot of governments have made commitments towards fighting child hunger, and it's important that they honor these commitments. So all these interventions that we spoke about today are low cost, high impacts. There are no sophisticated equipment, no specialized experts that are needed to, for example, be trained in the community. We can rely on community resources and we can capacitate the local communities. They are simple to implement in low resource settings. So now that funding is bottlenecking in the foreign aid sector, we need more than ever to prioritize low-cost, high-impact interventions. Save the Children is committed to tackling malnutrition and ending child hunger. And we are trying to prioritize and to channel funds towards this cause since the establishment of this organization. We believe that no child should die from hunger because hunger is preventable and these child deaths are preventable. So yet in this day and age, while we can send people to outer space, millions of children go to bed hungry every night. And this is just not acceptable because it's not just a crisis, it's a failure of priorities. And with millions of children at risk of malnutrition, we are not just failing this generation, we are dooming the future. So we are already taking some steps to fight child hunger, but real change requires all of us. So in the next slide, I'm going to be talking about what we can do, what we all can do as individuals, but also as advocacy networks. So some of the most important, I think, areas of interventions or areas of action are related to raising awareness and improving public engagement, to advocating for policy changes and for advocating for fundraising and resource mobilization toward the cause. So if we're talking about raising awareness or enhancing public engagement, we talk about awareness campaigns, maybe events using social media to talk more about the topic. Like an example is this webinar also. We want to engage also with influencers and invite them to leverage their platforms to amplify the messages around this cause. Organizing events that, for example, rallies or panel discussions that would draw attention to the crisis, that would help us advocate for more attention towards this crisis. When we talk about policy change and advocating, so whether it's we working with governments to prioritize hunger relief in domestically and in foreign policy, that's something that's quite important and that Save the Children works on. Lobbying for foreign aid expansion, very important to also ask for more food assistance. for health and nutrition programs abroad for children, engaging with lawmakers. So whether it's petitions or letter writing campaigns to involve the government in this discussion, reach out to food and beverage companies. So we talked about the companies that make the formula milk, but also other food and beverage companies that market their products. So we want to ensure that their exported products meet the same health and safety standards as those that they sell domestically. We want to hold them accountable for unethical marketing and harmful products that disproportionately affect children in lower income countries. So this is a very important matter also to advocate for. When we talk about fundraising and resource mobilization, of course, fundraising campaigns, raising money through events, even donating to organizations that work on this topic. A lot of the organizations and the international NGOs that work on this internationally and domestically have on their websites certain fundraising platforms. For SAVE, we have the Gifts of Joy, and you can choose to donate to specific interventions, for example, for malnutrition, for childhood illnesses. Another thing that could be done when you talk about fundraising is partnering with businesses and foundations. So working with companies that have a corporate social responsibility department, philanthropic organizations, and also encouraging monthly giving. This also sets up this recurring kind of donation system that ensures long-term support. So this is my presentation. So I'll stop here, and I can see some hands raised already. So over to, I guess, Stella, or I'm not sure.
Over to Kathy. She's going to handle questions.
Okay, great. Thank you. Sorry. Hi, Kathy. Over to you.
Kathy Thompson, yeah.
Yes, we have quite a few, so I'll get right into them. First from Linda, the decimation of USAID has shocked the world. How has this affected Save the Children Canada, and what is your organization doing to respond?
Yeah, I'll answer a question at a time, right?
Probably work that.
Yeah, let's do that.
Yeah.
Okay. Sure. Yeah, so the move, really, the stop order, the move has took, I think, the whole sector by shock, by surprise. It's affecting, if not all of the organization, if not most of the most of the organization, if not all of the organization that are working in the sector. At SAVE, we have some other resources of funding that we rely on. So philanthropy, foundations, private donors, other governmental funds that we obtain from different governments around the world. But also what we're trying to do is to channel funds to different sources of funding into our programs so that we don't stop our interventions. So it definitely impacted our programming, but we are looking to see how we can have continuity by searching for other funding sources. But things are changing day to day. But the only thing right now that we can say is that Save the Children has a steadfast commitment towards ending child hunger, and we will try always to ensure the continuity of our programs in view of the funding bottlenecking that's happening.
Great. That's a very hopeful response. Linda also has another question. Does Save the Children work to support prenatal nutrition in women, such as prenatal vitamin supplements and local sustainable agriculture, access to nutritional local food?
Yes, so we do have programs. We work on, in Save the Children, we work on health, education, nutrition, livelihood, protection. So we have different programs. What I talked about right now is specific programs, interventions that target child hunger or malnutrition. However, we have different programs and different interventions that tackles the topic of maternal health. We also work on agriculture and sustainable agriculture and livelihood. So that is also certain projects in certain countries do tackle these topics. Yes.
Okay, great. From Joanne, does Save the Children work actively with the governments in the countries where you work? Why or why not?
For sure. We definitely work with the governments wherever we're based. We work very closely with the government. It's very important. It's an important aspect of our work. So advocacy and strengthening for example, the systems that are already there, because we don't want in our work as NGOs, and not just SAVE, I think most of the NGOs working in the sector, what we want to do is not create parallel systems. We want to strengthen the systems and to capacitate the people, the local communities, in order to ensure sustainability. So we work with governments, we work with governmental institutions, so that we can together work on the different topics that we talk about. We also work, for example, as Save the Children Canada, we do work with GAC, so Global Affairs Canada, Affaires Mondiales Canada. So we work with them, and we always communicate with them. They provide us with funds. We submit our proposal. They provide us with funds, and we implement globally. So there's definitely communication and coordination with governments, whether here in Canada or in other countries where SAVE is operational. It's crucial for our work, definitely.
Okay. All right. And Gail would like to know, has Save the Children benefited from the 360.6 million pledged by Minister Hussein for nutrition?
I think for this fund that we have benefit from the FIAP commitment. We have benefited from the 10 years commitment that the government of Canada has committed towards international aid and foreign aid. I think if I can get back to you on this specifically, this fund, but I think if that is part of it, of that commitment, then we probably did have certain proposals that were submitted along this fund. But I can double check on this matter specifically.
If I could just jump in, it's Pat. Gail is referring to the announcement that the minister made in advance of the Nutrition Growth Summit. So I know that Save the Children has been involved in the coalition of nutrition groups who've been advocating for 650 million over 5 years. So that at this point, that is a commitment for the future. And I would expect that Save the Children would in fact benefit from that as well.
I remember now the campaign that you're talking about, Pat, the one where we had the different organizations were working together to advocate for that fund. I'm now okay. I thought we were talking about the 10-year commitment. So yeah, Save the Children was part of that advocacy group that worked on asking for this commitment. Yeah.
Okay, we have two more questions. One more just popped up, but we have so. Tina would like to know: can Save the Children reach children in refugee camps?
I'm sorry. Kathy? Can you repeat the question?
Does Save the Children reach children in refugee camps?
Yes, for sure. So we work in different countries that are in a protracted crisis or in a crisis situation, in humanitarian settings where there are internally displaced camps, where there are refugee camps. So these are people living in these camps are vulnerable groups that are in need of a lot of assistance and support and services. So we do reach people living in camps, children, of course, and through different services and different activities. But yes, we definitely work in both the humanitarian and development sectors. So we do work with refugees and internally displaced populations when they exist in a certain community or in a country.
Okay.
And I think this could be the last question, Kathy, as time is marching on.
Okay. So Sissy would like to know, what are the challenges when engaging local groups and governments in addressing child nutrition in the communities? Could you provide a real case example?
Yeah, so there are a few challenges once we're working with the local communities. Some of them sometimes is maybe the capacities. So let's talk about capacity building. So what we would do when there aren't the capacity or knowledge around this topic, we would first build the capacities of the people that are intent to work on the topic, or the local organization or the local partners that we're working on. So one is building the capacity around the understanding of an importance of a comprehensive approach, because sometimes they might have an idea in mind of how they want to tackle a certain topic, but through the evidence that we've collected and through what worked in different countries and in different settings for us, it's important that we share this knowledge and we transfer this knowledge so that we capacitate them, so that they would then work on these interventions with our support. Another thing is that sometimes it's it's localization efforts. So a part of what we do at Save the Children is we try to build on localization efforts, and in order to be able to do that fully, we need to truly partner with these organizations and provide them with the information they need, with the funds that are needed to make something happen. But also sometimes we need to think about one important component that maybe is not always thought about is sustainability. So how can we support local partners, but at the same time guarantee sustainability? That is another challenge, and we try to see how do we improve the local services so that there is sustainability to the services or the activities that we're doing. So that is also another topic that is very important in the conversation around localization. Also, another thing is getting the buy-in or the engagement. So if we do any kind of top-down approach or any kind of parachuting certain interventions without really contextualizing, we are going to face a lot of challenges, and not all interventions can be just implemented as is. So I think one important lessons learned for organizations working in our field and from our experience is the importance of actually contextualizing, working with local partners to contextualize whatever intervention we're doing. What works in a certain setting doesn't have to work in another setting. So taking into consideration being culturally sensitive, taking into consideration the unique needs of the children in a certain community, that's also something that we work on when trying to work with local partners and to build their capacities on a certain intervention. So these are just some of the challenges that I can list right now. But I don't know if we have more time to talk about. Maybe we can talk about also community engagement and having the organizations collaborate with local communities. That's also something that's very important within our work. So having true and not tokenistic community engagement in our work with local partners.
That's great, Lou, that we've made you speak very quickly there at the end. I apologize.
No, I'm sorry.
That's okay.
I'm sorry if it took longer than predicted, but
No,
I'm happy to answer questions, and I'm happy to, yeah, I'm sorry if I'm going too fast. Yeah.
Maybe you could stop sharing your screen now, and then we can see
sorry.
you all, and then Linda's on board.
Yes, it's my honor to thank you, Loubna, for this very rich presentation. Just much appreciated. Just a couple of things, that really hit home for me and answered some of my core questions was your description of the levels of malnutrition and the interventions, because we've been advocating so much for sustainable agriculture and just wondering where do supplements fit in. So that was really helpful information, as well as your focus on the broader issues in terms of strengthening the health systems, water and sanitation. It seems to be those are such important systems, and yet we often forget about them. And thanks also for that long list of things that we now can go back and take a look at, and things that we can do, suggestions for us. Really appreciate that.
Linda, could I ask a question? Linda, could I ask a question? Yeah, it's Sheila Loubna. Excuse me, I was wondering how many countries other than Africa, are there many countries in Asia or South America that you work with? And I think we have a problem with partnering with the companies who do beverages, because they have a lot of sugar and chemicals and so on in them, and they're likely to submit the kinds of liquid supplements that don't have as much nutrition in them as other things. Could you respond to that?
Thank you, Sheila. So yes, Save the Children works in Africa, but we also have offices in all the other continents. So we have offices in the Middle East region. We have all offices in South America. We have offices in Europe. We have offices in Asia and Southeast Asia and South Asia. we work in more than 100 countries, and we don't only work in Africa. So we have offices all around. So that's for the first question. But of course, in every country, we would work on the basically the issues that the country is facing, or the issues that the children in the country are facing. So not all interventions are just implemented everywhere. So it depends on the context, of course. For the second question, yes, that's true. There are a lot of companies, food and beverage companies, that would produce and market certain products that would be, and also that would export certain products to developing countries that they wouldn't sell locally. So that's also a part of the ethical dilemma also with this and their marketing strategies. They have very aggressive marketing strategies. And this is what organizations and institutions try to advocate and lobby and fight for. It's been a long fight, and it's a continuing fight in making sure that yes, we do advocate with these companies, but at the same time, in parallel, we work with governments and we work with organizations and UN agencies to set systems in place that wouldn't allow, or that would detect these marketing strategies, that would put laws and legislations in place that would forbid certain elements in the marketing strategies that would, for example, target children, or market for their products within, for example, vulnerable communities. So that's what we try in our work. Sometimes there are certain communities that are approached by companies that produce milk formulas, and in our line of work, we always try to work also with communities to raise their awareness about the impact and the risks that their children will face if they consume these beverages or this milk formula only. So it's not just working on advocating and talking to these big corporates or big companies. It's also working with the governments to establish certain systems and legislations in place. But it's also working with the community, raising awareness and empowering people with the knowledge they need to be able to make the decisions that would work best for them and their family and their children.
Thank you very much for that, Loubna. Really appreciate it. We actually need to pull our conversation to a close, and I know we probably could go on for another hour. There's just so much interest, and I really appreciate you spending this time with us. So I'm going to pass this back to Stella, who's going to wrap things up for us.
Okay, well, that was a really comprehensive answer. So thank you, Loubna, for the answering the extra question. But I do want everyone to know that if they send questions to info@grandmothersadvocacy.org or the other grand email address afterwards, then I will make sure they get to Loubna, and I'm sure that she will do her best to answer us.
For sure.
The extra questions. I know we're very interested in this topic. It's been hugely useful. So now, finally, I think we need to try and get a screenshot and record who has been on this meeting, this learning event. And what I would ask everyone to do is temporarily open up your video if you have it, if you're not on video. And as soon as we get the majority on video, then Linda is going to take a photo. I'll try and do a backup photo too, a couple. So, Joanne, I don't know if you're there, but maybe you can, maybe, I don't know where Joanne is. Anyway, so Linda, I think you can go ahead, and I see most of the people have their video on, so I'm going to start taking a photo here.
Sorry, I got 2 shots there, Stella. I think we're good.
Okay, great. I think I have everyone too. So thanks so much, everyone, for coming. And let's see. We're
And
so
if I could
busy.
just say to Loubna, we would like to reach out and connect after this because there's a follow-up question I have for you as well.
For sure.
Okay.
Thanks, Linda, of course.
So I hope everyone's found this learning event as useful as I have. Um, we understand it's a hugely complex problem, both in Canada and the global south. We do hope to see you all on a learning event soon, our next learning event, and look forward to our collective participation in advocacy. You will be receiving a advocacy toolbox or set of directives, and we all need to advocate. That is our purpose. And with that, I wish everyone a really good afternoon, morning, whatever it is. I think it's afternoon for all of you now. So take care and stay safe, everybody.
Thank you, Loubna.
Thank you, everyone. Thank you so much. Have a good
Thank
day.
you.
Thank
Yeah.
you.
Thank you.
you.